You could help support the One Thing podcast by visiting our affiliate sponsors. I've teamed up with Healthgevity, which is a company that I learned of over the last several years. I really enjoy what Healthgevity is doing. They've revolutionized the wellness industry by providing the finest quality and most effective nutritional products for ultimate health span. They work in tandem with doctors, patients, and researchers to design real advanced formulas that, frankly, I have not seen done on this level before. Please visit them and see what they have to offer. If you find various products that you're interested and you're looking for a discount, you can enter in the code ONETHING, all one word, one thing, for a 10% discount. This will not only provide you access to excellent health supplementation products, but also will help support the podcast. Thank you so much, and I appreciate your support. If your partner forgets your birthday, is it carelessness or a neurologic regulation issue? Today's guest says ADHD isn't about attention at all. It's about time blindness, emotional overload, and the silent exhaustion of trying to stay organized in a world not built for your brain. And once you understand that, everything changes. Welcome to the One Thing podcast, where we peel back the layers of health, performance, and well-being, one deep conversation at a time. I'm your host, Dr. Adam Rinde. Today, we'll be talking about one of the most misunderstood and overused acronyms in modern psychology, ADHD. But forget what you think you know, because this isn't about fidgety boys or just trying harder advice. Joining us today is Dr. Shirley Hershko, a globally recognized ADHD specialist, researcher at Hebrew University, and founder of the ADHD People. She's the creator of the Just a Moment time management method and the author of the new book, Making Sense of ADHD, finally available in English. In this episode, Shirley dismantles common myths about ADHD, especially how it shows up in adults, in women, and in high-functioning individuals who often slip through the cracks. We explore why ADHD isn't a focus problem, but a regulation problem, one that affects everything from sleep to relationships to how you eat. We'll talk about why trauma can masquerade as ADHD, how executive function disorders derail couples and careers, and how to actually get a meaningful diagnosis in a world full of self-diagnosis. Whether you're a parent, a partner, or someone quietly wondering, could this be me? This episode is a must listen. Let's dive in. Shirley, welcome to the One Thing podcast. It's really great to be here with you today.
Thank you for having me.
You're welcome. I really would love just to get into our topic today. This is such an important topic for our audience, and we've been really needing someone to come on the podcast to help us unpack ADHD. Before we get into that, I'd just like to hear things that you're working on right now that you're very excited about, that are pushing your work forward.
So right now, I am truly excited about expanding my ADHD services on a global scale in response to the growing need for accessible and effective support. So there's a clear demand for both accurate diagnosis and meaningful treatment for people with ADHD in all corners of the world. This realization led me to give online assessments via Zoom, which enable me to connect with individuals regardless of their geographic location. And another recent milestone that has brought me a tremendous excitement is the publication of my first book in English, Making Sense of ADHD, now available on Amazon. My motivation in writing and sharing this book was to provide people everywhere with a comprehensive, practical resource, something that brings together both the essential knowledge and the actionable tools for living well with ADHD. And the response so far has been enormously encouraging, and I'm really excited about this book. And finally, my work is driven by the vision of a world where anyone with ADHD can readily access the supports they need, whether that means an evidence based evaluation or intervention or empowering knowledge to manage daily life more confidently, I think.
Yeah, it's great to have been reading your book, and it goes beyond just sort of the general basic things that you see out there. And there's a very nice framework, and I'm sure we'll cover some of that today. So it's great that you're available internationally to provide these services. It's really well needed. A lot of people are trying to figure things out on their own. So what led you into ADHD? I saw that, your educational track was very stepwise, systematic to bring you here. But did you have an early vision to get into this type of work? Because it seems like you've really been at it for quite some time.
Yes. Actually, my journey into the world of ADHD began during my studies in psychology. As part of my first practicum, I worked closely with a woman who had ADHD, and that experience was truly transformative for me. Suddenly, I discovered an entire community that I immediately connected with. And what struck me most was the unique nature of this population. I like their creative thinking and cleverness and spontaneity and humor and all around fascinating mind. Beyond their remarkable strengths, I also became deeply aware of their invisible challenges. People with ADHD often live with difficulties that aren't always visible to others, which means they can struggle greatly, often misunderstood and unsupported. What fascinated me further was how, with the right approach, you can so clearly identify supports and treat ADHD, often resulting in meaningful and rapid changes in people's life. And eventually, ADHD touched my personal life too. I married a partner with ADHD, and together we have three daughters, each of whom also has ADHD. This brought the condition even closer to home, making it an integral part of my professional and also my family life.
Okay, so you really had a vision from early on.
Yeah.
So there's a lot of myths about ADHD that I think people get confused by, and they water down the message and water down what the condition is. What are some of the biggest myths that people believe about ADHD that kind of make you feel nuts about this, like that make you pull your hair out sometimes?
Yes. I think the idea that ADHD is simply a focus problem in hyper little boys is damaging. ADHD is not about laziness, lack of effort, or simply being easily distracted. That limited stereotype misses the core of the condition, executive function, which affects memory, emotional regulation, planning, prioritization, and the ability to follow through, not just start. Even more frustrating is how people assume you grow out of it. In truth, ADHD doesn't go away with age. Adults with ADHD may not be bouncing off the walls, but they are missing deadlines, losing their keys easily, and constantly questioning their own productivity, even though they are working so hard. This myth leads to shame, underdiagnosis, and stigma, especially among women and high performing individuals who feel like they should be able to handle this. And my passion is in dispelling these myths and showing people they are not broken, they just need reality based tools and a better understanding of how their brain works.
Mhm. And you've called ADHD a condition of time blindness and regulation issues. not just a focus or attention issue. Can you walk us through that and what that means for people who don't understand those terms?
Yes, of course. Time blindness refers to the way many people with ADHD experience time. It's not linear and rarely intuitive. For them, there are only two types of time: now and not now. And this creates a chronic lateness, misjudging task duration, and constantly under or overestimating how much they can do in a day. Even with the best intentions, they can feel like time is slipping through their fingers. And regulation is really the underlying issue. Attention regulation, emotion regulation, and self regulation. ADHD is fundamentally a developmental delay in the management systems of the brain. Someone might hyperfocus for hours on one thing, yet be unable to send a 2-minute email. And this inconsistently isn't about willpower, it's really about the dysregulated neural system. Once we shift the narrative from attention deficit to regulation deficit, everything makes more sense, from emotional reactivity and sleep struggles to job performance and relationship stress. ADHD isn't about not caring or not trying. It's a mismatch between internal systems and the structure of the world demands.
That's a very good point. I think in the world demands, so many people are feeling like they have ADHD or experiencing like they have ADHD, and with lots of data and things coming towards them. Can we go into that directly? Is everyone just calling themselves ADHD now, or are we actually seeing a clearer identification of who can be diagnosed with ADHD?
Mhm. I think accurate diagnosis of ADHD has improved, and public awareness of the condition has also increased significantly. However, it's important to distinguish between true neurodevelopmental ADHD and attention difficulties that can affect anyone due to stress or modern life's constant demands. I think that's why it's essential to undergo a comprehensive assessment so we can understand the real source of the challenges and offer interventions that truly helps.
Mhm. So a number of people have come to me over the years, and they finally find out, at a later point in their life, that they have ADHD. They finally get a framework to understanding that this has been going on for quite some time. And it's unique because they're adults at that time. So how does ADHD show up in adults, especially in areas people don't expect? Like, what would people notice if they have adult ADHD in their day-to-day life?
Hmm. ADHD in adults can be surprisingly subtle and differ significantly from childhood presentations. Instead of external hyperactivity or obvious inattention, adults may experience chronic disorganization, emotional overwhelm, and difficulties completing daily responsibilities. For many, ADHD manifests as missed deadlines, as struggles with time management, or feeling like behind tasks. It's not uncommon for adults to be labeled as scattered or forgetful or procrastinators without recognizing that ADHD underlies these patterns. And another unexpected domain is emotional regulation. Many adults with ADHD experience strong mood swings, frustration, or feelings of restlessness that can affect relationships and self esteem. These emotional symptoms are often misattributed to maybe anxiety or mood disorders, but in fact, they are part of the executive function challenges at the core of ADHD.
Yeah, I recently learned about that. I think there's a term called RSD. Maybe we can get into that later, and I'll put that into the show notes just that kind of if people aren't familiar with that. But there seems to be some confusion about ADHD because it seems to have a different presentation gender wise. Perhaps you can shed some light on that. How do men and women differ in their ADHD presentation, and especially, if they're going through a diagnosis?
Hmm. Many people with ADHD grow up thinking their struggles are just personality limitations or a lack of discipline. Some of the most commonly overlooked signs include chronic procrastination, trouble finishing tasks, and unusual ability to focus intensely or hyperfocus on activities that are highly stimulating or interesting, while everything else falls by the wayside. Internal experiences are crucial. Adults who may feel overwhelmed by tasks such as responding to emails, organizing paperwork, or staying on top of appointments. Others have hard time to know how long things take or losing track of hours. And these issues may be hidden by external coping skills or masked by outward achievement, making them easy for both the individual and those around them to miss. And lastly, frequent feelings of guilt or shame over not meeting expectations, emotional reactivity to criticism or change, all in an attempt to compensate, are often overlooked signs that suggest ADHD, not simple stress or poor time management.
So, how do boys and girls differ? What about women versus men? Like the difference in when you're sitting down with someone and assessing them, how is it different? The diagnosis and just how the condition presents.
Hmm. The differences between genders in ADHD presentations are substantial, and these differences contribute to the frequent underdiagnosis in girls and women. Boys tend to show more outwardly disruptive behaviors like hyperactivity or impulsivity, leading teachers or caregivers to refer them for evaluation sooner. Girls, on the other hand, are more likely to exhibit inattentiveness, daydreaming, or internal restlessness without visible disruption. As a result, they often go unnoticed in classroom and the family setting. And in adulthood, women often became masters of masking, organizing and overperforming to meet social and family expectations. They may experience intense emotional reactivity, chronic stress, or persistent feelings of overwhelm, especially during life transition like motherhood or career changes, whereas men's ADHD may be recognized through performance difficulties at work or impulsive behavior. So, women often present with anxiety, depression, or relationship challenges, leading to frequent misdiagnosis. Furthermore, the cultural expectations placed on women to be organized and multitasking mean that failures in these domains are perceived as personal shortcomings rather than neurodevelopmental struggles. This not only delays diagnosis, but can also cause significant internalized shame and undermines self-esteem.
Mhm. So, why do so many high performing women get misdiagnosed or ignored?
Mm. High-performing women with ADHD have often developed powerful but exhausting strategies, like perfectionism, over preparation, extensive note taking, reliance on lists and reminders, and working harder and longer than peers just to meet baseline expectations. Because these women outwardly appear successful and in control, both they and their clinicians may overlook the immense internal struggle and the toll it takes on mental and physical health. Misdiagnosis is also fueled by the fact that women with ADHD often present with anxiety or depression symptoms, which are treated as primary conditions. The ADHD is hidden behind these more visible issues. Additionally, social stigma and gender roles mean many women are reluctant to voice struggles with the organization or forgetfulness or time management for fear of being judged as lazy or unstable. Importantly, clinicians may not examine childhood symptoms or may undervalue the impact of inattentive type of the ADHD, especially in high achievers. Without careful listening, these cases remain undetected, leaving women unsupported and at risk for a burnout, self-doubt, and reduced quality of life.
Mhm. So another hidden face of ADHD that's near and dear to my heart and to many of our listeners is trauma. And you share how traumatic experiences sometimes express as an ADHD presentation or trauma from a standpoint of PTSD or PTSD linked traumatic experiences.
Mhm. Yes, it's an important issue. And trauma and ADHD share considerable symptom overlap, including difficulties with attention, emotional regulation, and impulsivity. Individuals who have experienced traumatic stress, especially in childhood, can develop coping mechanisms or neurological changes that mimic the executive dysfunction of ADHD. For instance, distractibility and emotional dysregulation are common outcomes of trauma and can be mistaken for core ADHD symptoms. This overlap can be confusing. Trauma can worsen underlying ADHD, making symptoms more pronounced, or it can create a pseudo ADHD picture in someone otherwise neurotypical. It's important to parse out the timeline. Did symptoms predate trauma, or do they emerge primarily in relation to traumatic experiences? A careful assessment is required to distinguish whether trauma, ADHD, or both are present. Additionally, the mechanism is sometimes bidirectional. People with the untreated ADHD are themselves at higher risk for experiencing trauma because impulsivity and situational misjudgment can put them in harm's way, and chronic failure and experiences can be traumatic. So treatments must therefore be trauma-informed, holistic, and attentive to the full personal history.
So one of the things I really enjoyed about your book is how you go into the different facets of how ADHD intersects with relationships and lifestyle and day to day things, because it's not just a school or work issue, right? How does it impact marriages, friendships, and communication style?
Mm. ADHD can have a profound impact on adult relationships. In marriages, ADHD related to forgetfulness and distractibility or emotional intensity may be perceived by partners as a lack of care, a reliability, or emotional availability. Simple miscommunications, forgetting to pick up groceries or missing important dates, can lead to significant frustration or conflict if not understood within the context of ADHD. And friendships can also be challenged. People with ADHD may struggle to stay in touch, respond to messages, or maintain consistent contact, resulting in relationships that are deep but sporadic. Emotional reactivity can play a role here too. Rapid changes in mood or impulsivity, spoken words, may cause misunderstanding or hard feelings. Awareness and open communication are important here. I think partners and friends who understand what ADHD looks like and that it's neurological, not intentional, they can shift from blame or I think from blame to collaboration. And patience and routine check-ins can also help mediate challenges while both sides learn to appreciate the unique energy, creativity, and passion that often come with ADHD.
Yeah. I imagine that just having that framework of knowing it's that ADHD is something that a partner is struggling with can save a lot of relationships just to know that and have a framework to think through. So other things like sleep, eating patterns, and just overall behavioral regulation. Can you talk about how ADHD intersects with that?
Yes, of course. Regulation difficulties are at the heart of ADHD, and this extends to fundamental physical processes like sleep and eating, insomnia, trouble falling asleep, delayed sleep phase, and restless sleep are common in adults with ADHD. Many experience revenge bedtime procrastination, resisting going to bed as a way to regain control or squeeze in more stimulating activities at night. This in turn leads to chronic exhaustion and daytime inattention. About the eating patterns can be similarly dysregulated. As some people with ADHD may forget to eat or eat erratically, while others may gravitate towards emotional eating or snacking for stimulation, especially late at night. Impulsivity can lead to choices that are less healthy, and difficulty with meal planning or grocery shopping is common due to organizational challenges. So overall, regulation is the core challenge, whether it's time management, emotion, sleep, or eating. Solutions often involve structuring environments, consistent bedtime routines, meal prepping, alarms and reminders, and professional support as needed. Addressing these lifestyle domains restores balance and can improve not only ADHD symptoms, but overall well being.
It's so important for people to understand that, especially as a provider, helping people make these changes. Or, people could say, well, there's so many things you could do to help your ADHD. Here's a list of 20 things you could do. And to start with that for someone with ADHD is, just completely not getting the picture. So I think it's really good that you point out, that there needs to be some help and assistance with bridging all these wonderful ideas and suggestions that people have. How about couples? You talked about earlier, in your own family. And I think a lot of people can relate to this that are listening. Is like one couple who has the ADHD and the other doesn't. What do you see? How do people make it work?
Mm. I see frustration in the ADHD-related behaviors are misunderstood, the forgetfulness, the disorganization, sensitivity to criticism, or emotional intensity. The non-ADHD partner will take more executive responsibilities, managing bills, organizing schedules, or following up on tasks, leading to burnout or resentment. However, when both partners educate themselves about ADHD and engage in ongoing honest dialogue, these differences can be reframed as complementary strengths rather than deficits. I think collaborative strategies, shared planning tools, humor, and external support like consulting or coaching can transform the relationship into a state of resilience, adaptability, and deep mutual understanding.
Well, one of the great things about talking with you is you have such a profound background and you've built this really substantial knowledge base and career about ADHD, mental health. And now you're in a position where you can actually make diagnoses and recommend treatments. So you really are at a great position to walk us through the approach to diagnosis. So what's missing in typical evaluations?
Hmm. First of all, thank you. And I think effective ADHD diagnosis requires a comprehensive, multi-layered approach. Too often, standard evaluations rely heavily on self-reported symptom checklists without getting deeper to daily life, executive functioning, or the impact across multiple domains. I start with a thorough developmental history, focusing on not just childhood symptoms, but also asking questions about work, school, relationships, emotional themes, and so. Collateral information is also crucial. Input from family members, partners, or close friends who can provide context about real world functioning. I look beyond the DSM criteria to assess the functional impairments. How do symptoms interfere with life, not just whether they exist? This includes exploring the presence of co-occurring conditions like anxiety, depression, trauma, learning disabilities that often complicate or mask ADHD.
Mhm. So medications and ADHD is sometimes in certain circles controversial and others it's not. What role do you feel medication should play and what are people misunderstanding about it?
Medication can significantly improve attention, also impulse control and executive functioning, enabling individuals to implement behavioral and lifestyle changes more successfully. However, medication works best within a framework of education, coaching, and also environmental supports. A common misunderstanding is that medication will fundamentally fix someone or instantly make them normal. In reality, these medications correct imbalances in the brain chemistry enough to allow for self-regulation, but habits, skills, and support systems are still essential. Moreover, medication cannot address underlying emotional wounds, trauma, or learned helplessness. This requires different intervention.
Okay. There's a method that you've developed called just a moment. And I think that deserves a, at least if, as much as you're willing to share about it. And how does the just a moment method help with time and task regulation?
Okay, so the just a moment method is the practical system for time and life management. designed especially for people with ADHD. The method is based on simple, actionable tools for planning, prioritizing, and simplifying tasks with the aim of reducing stress, gaining control over your schedule, and experiencing greater calm and accomplishments, I think, at work, in studies, and in personal life. What makes the method unique is its clear structure built around three easy to apply stages. And these steps help identify what is truly urgent and important, divide tasks according to different life domains, and manage time in a way that fits style and also needs. The approach moves away from constantly putting out fires and helps build more order, stable routines, and a real sense of control. Organized time management saves hours of confusion, boosts work efficiency, and reduces mental stress. According to research and clinical experiences, adopting the just a moment methods really leads to greater productivity and more free time, and I think a sense of relief. And that's the most important thing for me.
Great. And know you have a way of walking through your clients and teaching them these methods, and your book talks about it in more detail. And it's really great to have a customized time management system for people with ADHD. So this has been wonderful, and we just have a few minutes here to wrap up. But I'd love to hear some thoughts about your hope about how the world is changing around ADHD. What gives you hope?
I'm encouraged by the growing awareness and the openness around ADHD. It gives me hope that more people will be able to identify what they are experiencing instead of living with ongoing frustration or self criticism. The fact that accurate and in-depth diagnosis is becoming more accessible means fewer people will be misunderstood or overlooked, especially women who have historically been underdiagnosed. And I'm also optimistic because today there are practical tools and treatment options that truly help people manage ADHD and improve their quality of life.
Wonderful. We've talked a lot about some of the hidden faces and less known aspects of ADHD. I want to just, before we leave this altogether, just go into that just one more time. What's something surprising or under discussed in ADHD, that maybe everybody needs to understand, and maybe an aspect of future discussions in ADHD?
Mhm. Perhaps the most surprising fact is that ADHD is not a deficit of intelligence or ability. Many people with the condition are highly talented, creative, and resourceful. What they lack is not motivation or effort, but an internal regulatory structure that aligns with conventional expectations. And another, I think, critical but under discussed point is the profound impact that environment, home, work, school, and relationships has on symptoms expression. Small changes in external supports can lead to dramatic improvements in functioning, while misfit environments can worsen symptoms regardless of effort or willpower.
That's wonderful. I mean, also useful information for educators to continue to learn how to work with children and workplaces, how to work with adults with ADHD. So if someone's wondering after listening to this that, you know, this could be me, where would they start as far as getting help? and specifically with you, of course, in general.
So if listening to this episode resonated with you and you recognized yourself in the stories or symptoms discussed, even if not in every detail, it's completely natural to wonder whether ADHD might be part of your story. And the very best thing I think you can do is come for a professional assessment. Of course, you can do it with me because a thorough evaluation will clarify whether ADHD is truly present. ADHD can make certain aspects of life feel stuck or unfulfilled, often preventing you from reaching your full potential. Even if you've managed so far, things can generally become much, much better because there are effective tools and strategies that can make a real difference. So people are often surprised to find that the diagnostic process itself is not only clarifying, but also a truly meaningful and even uplifting experience. It's a change to finally understand yourself and gain validation for challenges that may have felt inexplicable for years. I also highly recommend reading the book Making Sense of ADHD in Amazon because this resource offers a comprehensive, accessible overview of what ADHD really is, how it manifests, and what you can do about it. Gaining the full picture can relieve unnecessary guilt and self-blame, helping you feel empowered and understood.
Wonderful. So we talked about your book, and we'll put a link in the show notes. As far as diagnostic services, can you talk about how people find that? And then finally, can you talk about the wonderful community you built on Facebook?
Okay, so first of all, about the diagnosis process, we can put a link, and you can reach me really easily. And my community, wow, it's a large community with more than 50,000 people with ADHD in Facebook that talk about ADHD all day long, about how they feel and what they need to do. And they feel like they found the home and the place that's really understand them.
Wonderful. Well, toda rabah, kol hatabod. Thank you very much, and great job today. Thank you. I really appreciate you being here.
It was really pleasure to speak with you.
Great. Well, we'll look forward to perhaps catching up with you on another topic down the road. But this is such a great start, and thank you for being here and informing us on this really important topic.
Thank you so much for tuning in to this week's episode of the One Thing podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from it. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing podcast. And again, much appreciation for you being here with me.